30 minutes per day, 5 times in a week.
60% contribution for the control of diabetes is with the exercise added. Exactly.
Most of the people think that insulin is the last resort in diabetes, so they are on a end stage of this disease.
We were talking about this physical activity. People are always happy to or eager to listen to what is a physical activity, because people who come to us, they have a belief that too much of gymming is now the new term that they use. What do you think? What is the ideal physical?
The thing is that according to American Diabetic Association and all, physical activity means a brisk walking, cycling, swimming, like that type of aerobic exercise, 30 minutes per day, 5 times in a week.
It's a 40 minutes per day for 5 days a week is enough and more. Maybe I will add one small scenario, Taj, now. See, nowadays, after this movie stars are behind six packs, we have seen a large number of people going to the gym. And I don't know whether it comes to your experience that people who are now in the gym, we see a quite more number of cardiac events happening inside the gym, because I feel many of us are overexerted, too much more than what we can do. Exactly. Everybody wants to have a six-pack. In diabetes, basically, as Dr. Nobel was rightly mentioning, there is nothing called the building up of muscles where you need to have only around 30 to 45 minutes of moderate physical activity for 5 days a week is enough and more. There is no need that you must be considering. Just to complete, I'll just add a bit more. I would say this quote that exercise must be considered as a B. So, you can't overdo it and you do not want to underdo it as well. Keep that balance. I have seen in that data that 60% contribution for the control of diabetes is with the exercise added. Exactly. That is about. So, diet, Taj, what do you think? Diet is like, it should be balanced in the calories. What we are utilizing and what we are taking. It should be balanced. So, there is a question today, there is a party and can I eat a sweets? Very commonly asked, very common. So, yes, you can adjust the sweet. Just you have to take care about your calories, how much calories you are taking and how much calories you are burning. So, now with the recent advance in gadgets and everything, we are having a gadgets also now in a recent advance for control and tracking of our blood sugar. Yeah, very correct. That's a good idea to talk about that freestyle lever which we attach on our body, which will help us monitor the sugar over the 2 weeks time. That's what the company is telling. So to take sweets, I have read that 180, below 180, if your sugar is below 180, yes, you can have little sweets, plan your meal, enjoy the day, enjoy your fun self, and do the exercise. If you eat something more, yes, see how much you have ate and how much you have to burn. So, Jiju, what do you think about that aspect of Dr. Taj, where is it must that we must be avoiding all the sweets, or is it a way that you balance the intake and the burnout?
Yeah, so when it comes to diabetes, what I would like to stress is that it is all about limiting the portion size and increasing the number of portions. So whatever you eat, you of course have to limit the calories, but when you eat something, you just limit the portion size. And now with all these gadgets that we've got all these AccuChecks, we've got all these monitoring machines at home. So I would actually advise the patient to monitor his own sugar, because one size doesn't fit all. That's the main thing here. So when you monitor your sugar before the meal and after the meal, also especially after having a sweet, he will know what he has to do to tailor his sugars according to his needs.
Exactly.
So that is very important in current scenario nowadays, because then he will be able to, he is the better doctor of, regarding his health needs, he is the better doctor, because he will know what he has to take, because if somebody else takes that, it might be hazardous for them, but it won't be for him.
What is the concept that, Dr. George, does your patients scare about insulin?
Yeah, so that is another myth. The people feel that once they are on insulin, it's a never-ending journey. But see, we have to understand that insulin is normally produced in the body to tackle the blood sugars in the body. So what we are just giving is something from outside, because the body is not meeting the demands of the sugar demands. So the only thing that one has to be scared if they are on insulin is don't take too much or too less, because the effects of that will be what is harmful for the individual, not the insulin itself.
Exactly. But I think you also would have people scared about insulin.
Most of the people think that insulin is the last resort in diabetes, so they are on an end stage of this disease.
All the patients believe that insulin is something that is given at the end. Absolutely not. Yeah,
But it is not like that, because in lot of other conditions also we will use only insulin. Like in pregnancy, gestational diabetes or diabetes in pregnancy, recommendation is to use rapid acting insulin like Lispro or Aspart. That's a recommendation. So we will convey the message to the antenatal pregnant lady. They are willing to use.
Moreover, the scare is that people believe that insulin is given in the last stages, but we know that no, insulin can be given in the initial stage. But we can start asking, what is that? What is the reason, doctor? What do you think, Taj, that people are scared about? Why are they scared about insulin?
So the middle,
Yeah, exactly.
and is there, and our scientists are trying to develop some nasal insulin and some pills for that, but still we are in the process. I haven't seen.
Yeah, true. I will just add to that. Okay, this nasal insulin, this research was done in Stockholm, Karolinska. They dropped it totally. It was one of the very best in the world, and he was nominated for Oscar as well. Sorry, not Oscar, the Nobel Prize as well. Yeah, it's because it would have been a really change in the world to give nasal insulin. The fear of the needle would have been there, but I think it's they are dropping it and building back on the insulins what we are having now.